Without further ado, I would like to um, introduce our first speaker, who is Laurene Allen, who is a resident of Merrimack, New Hampshire, and a social worker who co-founded a community group, the Merrimack Citizens for Clean Water, after learning in March of 2016 that the water she and her family had drunk for decades was contaminated with PFAS chemicals. Laurene has been an advocate for the needs of her PFAS impacted community for the last 5 years, engaging local, state, and federal officials, as well as bringing together residents to work together on both a local and national level. After working to gather health data in her own community, Laurene co-authored the 2019 environmental health publication called Making the Invisible Visible, Results of a Community-Led Health Survey Following PFAS Contamination of Drinking Water in Merrimack, New Hampshire. It's a pleasure to turn the session over to Laurene at this time.
Thank you very much, Alan. And I'd like to thank the National Academy for this opportunity to share the perspectives of communities. I appreciate the work that you and so many others have done. And I really am a firm believer in it's very, very important to hear what we are experiencing here and what we have experienced to help you best guide us. So that being said, I'll give you a little bit of background information about my community. Merrimack sits in the southern tier of New Hampshire, about an hour north of Boston. It's a wonderful community full of conservation land, and you would come up here and think that everything is just wonderful. So we learned in March of 2016 that the water that we believed to be safe was contaminated with PFAS chemicals. The focus at that point was on PFOA, or identified source is an industry called Saint-Gobain that engages in PTFE coating of fabrics. A lot of DoD contracts, and the fabric coating is full of Teflon. So for many, many years, the emissions coming from the factory have contaminated air. The air particulate has gone into the soil. The soil in the area has a lot of data there with PFAS contamination. And drinking water in this area of New Hampshire is primarily groundwater sourced. So groundwater is groundwater, right? So our public wells, 6 of them, 2 were immediately closed in 2016. They were over the federal health advisory of 70 parts per trillion. The other 4 wells are over the New Hampshire Health Advisory for PFOA alone, which is 12 parts per trillion. So 27,000 residents exist in this town. 25,000 approximately are public water users. The other 2,000 or so are private well owners. So private well owners have really been left on their own in this process. They were told back in 2016 that if their water was under 70 parts, they were, quote, safe. And without the guidance and, knowledge there, they kind of said, okay, so we don't have to do anything. And what should we do? We can't exactly, figure this out on our own. So what's happened since then is New Hampshire had a huge amount of citizen advocacy, not just in this area, but in the Seacoast also, to really look at the. So the state was commissioned to carry this process to determine what the levels were that were safe MCLs for New Hampshire. In that process, they received a lot of scientific input from many academics and many scientists, and residents at that point had become so informed that we submitted health science and things that we thought should be considered. So using the best and most rigorous science, they restricted it to human outcomes in critical endpoints. They determined 4 particular PFAS should have MCLs that were significantly lower than the current federal health advisories. So we're in this situation now where we know we've had exposure. Merrimack is not the only town. We have Bedford, Litchfield, Londonderry, parts of Hudson, parts of Manchester, increasingly numbers to the south. And this goes on and on and on. We have a 65 square mile identified and EPA recognized contamination area. And that area we're finding from air modeling is bigger than previously believed. So exposure is here. Our exposure is not just past exposure, it's current exposure. The discharges, the emissions, and all the activities of any industry user of PFAS chemicals right now is, I don't even call it a gray area. You know, it's very troubling to us in the community because we want our exposure to stop. We can see the harm, we can see the environmental contamination. And as people share information with each other and express health concerns with their physicians and state officials and local officials, we see the harm that we know is there in the patterns in our community. And we feel that we have a significantly increased burden of the harm of these chemicals. These chemicals are unregulated contaminants. They're not declared hazardous substances. So as you can see, it's been really complex and really hard to get the acknowledgement from healthcare providers. So the experience of people in going to physicians, primarily to the state and physicians, the first thing that people ask for when they find out that they've been exposed to toxic chemicals is blood work. Blood work should not be controversial. To me, it's a no-brainer. I'm a clinical social worker for many, many years, and I'm a big believer in biopsychosocial is the way I operate. So we look at biology initially. We want to know what is it in our bodies and what is it in our environments that possibly can cause health outcomes and behavioral outcomes. So that being said, it's been very, very difficult for people to secure blood tests. And, we've heard things like, well, what's it really going to show? And we know the exposure is there and we can't really treat it. Well, let me just give my thoughts about that. For blood work, it's really important, number one, to establish a baseline. We are exposed to a mixture of PFAS right here. We're way behind in the regulatory and the policy. We all know this. So our exposure needs to be documented for now and for future reference. We also know, based on the research, that there are several health conditions that are absolutely undisputably associated with PFAS exposure. I'm not going to get into a debate over at what level this is caused. It depends on so many other factors, as we all know, but we are at increased risk and we see those risks all through our community. So by my profession, we believe in prevention, early intervention. That should go hand in hand with public health. Environmental health needs to be integrated into our health records. If a person wants noted that they've been exposed to chemicals, that should be part of their health record. That's really important. Screenings can be done and should be done for conditions known to be associated with PFAS. We can treat these conditions sooner and prevent what we see here is this progression of illness. What we see here is multiple complications within households and within neighborhoods. Whole neighborhoods, the closer they are to this facility, the more illness and the more disease we see. The patterns are very, very consistent with what I hear from other people across the nation and other communities. So blood work is really important. It's not only validating to residents, it gives a piece of the puzzle. It can help, rule out other causes, right? And we have to kind of sort of know the why before we can decide on a treatment plan. Screenings are important for the same reason. I had a young client come to my office a couple of years ago who had been previously diagnosed with bipolar disorder. She was 11 years old. She had been put on lithium. Knowing what I know about water and knowing where she lived, I said, has her thyroid been checked? Well, we don't check thyroids initially with 11-year-olds. So I pushed a little bit. They did some thyroid testing and found a significantly damaged thyroid. So, if we had blood tests and if we had screenings and more awareness of contamination areas, that young person wouldn't have been diagnosed with bipolar disorder and put on lithium. So the symptomology that we experience, can look a lot of different ways. And we really, really have to do a better job of identifying what role does exposure play? What role does the chemicals in our body play? And what do we know about this? Another huge area to us here is immune functioning, endocrine disruptors, reproductive, metabolic disruptions, and immune functioning. When I look at the map of COVID over the last year, I am consistently struck by the fact that the 5 towns in this area that have the highest numbers consistently of New Hampshire are the PFAS impacted communities. I would love to know, what does that mean to people? If we know our levels, if we do some screenings, if we do some immune functioning tests, or if at a minimum we can integrate what we know about PFAS as disrupting or immune response, we would know that we would A, have to be more careful in this area. B, we may need boosters sooner for other vaccinations for our children, not just for COVID. And, this is just a little overview. There's so many things that could be done, with this. Follow-up is very important also. We need the follow-up, we need the education, we need physicians to understand the importance of risk reduction and stopping exposure to PFAS chemicals. So that's just a brief overview of some of the challenges that we face. And our physicians are largely unaware, as I'm sure you will hear from others in this panel, and need some really good guidance and really, really good support here, because we're 5 years into this at this point, and we need the support that we have not had in 5 years. Thank you very much.